Okay, next we're going to talk about some really common conditions that we see in the pregnant population. So Rhea and I see them a lot here, and I'm sure a few of you sitting there as I'm talking about them will say, oh, that's me, I've got that. So if that's you, give us a call tomorrow here at the physio department and we'll be able to help you out. We're sort of doing telehealth and phone consults at the moment, but a lot of these things we can help you out over the phone. So if we go to the next one, so round ligament pain. So what is that? The round ligament is a big ligament that helps to suspend your uterus to your body pretty much. So as your belly is growing and getting bigger and bigger, there's lots of strain on that round ligament. And as if you were to do quick movements where you're moving from side to side and your belly's kind of swaying, it puts a lot of strain on that ligament. So I guess a lot of the treatment is just being aware of that and maybe slowing down your movements. But also we would probably give you a abdominal brace, which I've got one here, or just a bit of tubey grip, like pregnancy tubey grip that you wear around your belly. I don't know if you can see me there, but if you wore this under your clothes around your belly, it would help to pull your baby bump in closer to your spine, and that can help with that pain. Varicose veins, they happen in up to 40% of pregnant women. They're not really sure exactly why, probably hormone related. And they can be really, really painful. You can get them on your legs or on your vulva. And unfortunately, there's not a huge amount you can do for them. The best thing you can do is avoiding prolonged standing and keep moving, because the more you move, the more blood and stuff pumps through those veins and doesn't sit there causing the aching. There is some evidence to say compression, so wearing compression leggings, whether you just have your sports ones like your Skins and your 2XU type leggings, or you can get medical grade compression garments as well. But there is some evidence that helps to move the blood through the veins and stops them as well. Carpal tunnel syndrome, it happens in the non-pregnant population, but it's very common in the pregnant population as well. And what it is when we have that build-up of fluid in our wrists, and it starts to compress in our carpal tunnel, which is a very small space that the median nerve and a lot of other tendons runs through. So there's not much room for extra stuff in there. So as soon as a bit of fluid comes in, it starts to compress a nerve called the median nerve, which supplies sensation or feelings to these 3.5 fingers. So what can happen if it gets compressed is you get pins and needles, tingling, pain in those fingers. And it can be really quite easily treated with circulatory exercises, so getting the fluid moving through the tunnel and out of the tunnel. And also we can give you a hand splint to help splint the tunnel open so things can move through and things don't get blocked in there. De Quervain's is more seen in the postnatal population, so after you have your baby. And it's an overuse injury of these two tendons just on the outside of your thumb here. And it's from all the different movements that you do with a newborn baby. So picking the baby up, when you're breastfeeding, you often cup the baby's head and you do that movement to get the head in a good position. And it causes an overuse injury. Again, we treat that with a splint just to stop you doing that movement pretty much. Braxton Hicks contractions, they're not exactly something a physio can treat, but just good to be aware of. I think your midwife goes through it a bit more, but they're kind of like, they call them practice contractions for your uterus. So your uterus it kind of feels like it's contracting. Some people, it's nowhere near as bad as labour. So some people do get a bit confused and think, what's that? But most of the time you think, oh yeah, that must be those Braxton Hicks starting. They normally feel after 30 weeks, but some people do feel them quite early. And they're not normally too painful, although some people do get quite painful ones, but you really just have to rest and wait for them to pass. Blocked ducts and mastitis. This happens in the postnatal population when you're breastfeeding, where your milk duct gets a bit blocked, gets a bit of milk stuck in there. If it doesn't move on with the next feed, it can get a bit infected and you can go downhill pretty quick. If it is infected, you do have to get antibiotics, but if you notice a lump and you get onto it nice and quickly, you can just call us here at Physio and we can actually do a thing called ultrasound, so like the footballers get, on your breast, and it helps to break up that blocked duct and move it on so before it becomes infected. So give us a call. Otherwise, massaging towards the nipple can help to bring the milk out so that the next feed you do, it gets sucked out. But give your lactation consultant a call as well. They'll give you heaps of good advice and they can refer you to physio as well. Now, sacroiliac joint pain or SIJ pain, we see this all the time in physio. This is our bread and butter, and I guarantee some of you will be sitting at home with this at the moment. So what it is when you're pregnant, you have a hormone called relaxin that gets released, and it targets the joints of your pelvis. So these two big joints here are called your sacroiliac joints or your SIJ joints. They have lots of ligaments that lie over the top. That hormone relaxin targets those ligaments, and it makes them become a bit stretchy and lax. And that's very good when it comes to labour, because it means that your pelvis can open up a little bit more to let the baby come through. But while you're pregnant, it means that these joints that are normally very stable and don't have much movement actually start to move a bit, and they kind of grind on each other, and they're very, very uncomfortable. So physio can help. So we can help by helping you to strengthen the right muscles and release the right muscles to help close that pelvis down. The other thing that we would probably give you, if this was the case, is a pregnancy belt or an SIJ belt. So I've got a little one here. Maybe I'll show you on my assistant Ree. So we just put it very, very low around the pelvis. This is a tiny, tiny one. I can't imagine any pregnant person that would fit into it. So we fit very, very low around the pelvis, and then it's got two straps on either side here that we yank forward, we pull really forward, and it just locks down the pelvis. So what it's doing is it's pushing the two sides of the pelvis together so that there can't be any of that shearing force. And how does that feel, Ree? Does it feel nice and firm?
Nice and supported, yep. Perfect.
So a lot of people will come into our office, will fit one of these, and they'll walk out feeling a lot better. So if you're sitting at home with some pain in your lower back there, then give us a call and we can help you out for sure. Piriformis syndrome does go hand in hand with the SIJ pain. So your piriformis muscle is a muscle in your glute or your big bottom muscle. And in a lot of people, the sciatic nerve actually goes through that muscle. Now, when your pelvis becomes a bit lax, that piriformis muscle grips onto your pelvis to try and lock it down. And in doing that, it can compress your sciatic nerve and cause some pain and tingling down the back of your leg. So same thing, we can really help by treating that. So give us a call if you're sitting at home with tingling, shooting pain going down the back of your leg, or pain in the middle of your glute. We can help with that for sure. Pubic symphysis pain sort of works the same as the SIJ pain. So your pubic symphysis is this joint at the front, so your pubic bone, so it's this joint down low at the front here. And same thing, that relaxin hormone makes that joint become quite lax, and it kind of makes this shearing type pain right at the front on your pubic bone, and that can be really, really helped with a pregnancy belt as well. Back care in pregnancy, we'll skip to that next one. So obviously when you're pregnant, you have a growing baby growing out in front, and with the weight distribution coming out of your abdomen, it actually pulls your lower back spine into a lot more curvature and can really cause a lot of lower back pain as well. The most common treatment for this is really just being very mindful of your posture. So trying to stand up tall, trying to use your legs and not your back when you're bending. I do have a little prop here, a little bendy man prop that can sort of show you a good lifting technique. So I hope you guys can see this prop. But if you can see the little segments of his back, if he lifts this box with his correct technique, keeping his back nice and straight and using the big muscles of his leg, you can see that the joints of his spine stay stacked over one another, and it looks nice and safe and healthy. If he did the wrong lifting technique, lifted the weight way away from his body, and you can see the strain on the little vertebrae of his back. So they're the people that just bend over, keep their legs straight, and they lift with their back, and you can see the strain on the vertebrae of his body. So just being really mindful of your posture is really good for your back pain as well. And And also doing some PA exercise, also abdominal exercises as well, can help to sort of pull the weight of your uterus of your baby back towards your spine, and it does make your posture help as well. There's lots of different reasons that you might get back pain, but usually having good posture can help. I've sort of gone through all of those. And what's going to happen to your tummy muscles, so your abdominal muscles? So it's very, very common that your rectus abdominis, or your six-pack muscle here, as you're growing a baby, the line down the middle of your six-pack starts to separate just to make a bit more room. That line is made up of fascia, so that's quite stretchy, so it just stretches so that you don't tear the actual muscle, and it allows room for your baby. But what that means is that after the baby comes out, you can be left with quite a big gap there. So what will happen is, if you're delivering in Horsham, I think Ballarat do a very similar thing. Once you deliver here, one of us physios will come and see you day 1 or 2 after you deliver in your hospital room. We're going to have a feel of your tummy, and we'll tell you how wide or small your gap is. If your gap is 2 centimetres or 2 fingers wide or larger, we'll give you a bit of abdominal tubey grip, which is this stretchy material here that you kind of wear, kind of like a boob tube top around your belly button, and that will help to bring those muscle fibres back together. Another thing that we'll give you sort of in the postpartum period is some transversus abdominis exercises. So your TA is this muscle that kind of acts like a corset. It sits very, very low on your abdomen and attaches to your spine. So it's like a corset in how it supports your spine. And it does become weak and stretched because of being pregnant, but it's very, very important for that muscle to rehab and become strong, just like your pelvic floor. So we'll help you with that in the postnatal, in your postnatal care.